My name is James McLaughlin. I'm a paramedic firefighter with Black Forest Fire Rescue. This is my partner, Travis, and we're here to demonstrate placement of the dual lumen airway device today. First thing you want to do is select your patient in. In this case, this patient's unresponsive and they are breathing inadequately. They do not have a gag, so we're going to place an oropharyngeal airway. We've properly sized it, placed the oropharyngeal airway, and now we're going to assist ventilations with a bag valve mask device. I'm looking for good rise and fall of the chest with ventilation, and my partner is going to assess lung sounds. With the presence of lung sounds, I've decided to place a dual lumen airway device. My partner is going to take over ventilations while I prepare my equipment. Thank you, sir. All right. The device we're going to utilize today is the combi tube. Another dual lumen airway device is the PTL. If you're utilizing the PTL, please follow your local protocols. When checking the combi tube, you want to check both the distal cuff, and you're checking the cuff to make sure there's no leaks or anything of that nature. Then you'll go ahead and deflate the cuff and get it in the operational readiness mode. And then you want to check the proximal cuff. And again, checking to make sure there's no leaks or anything of that nature. Then you'll go ahead and deflate that cuff as well. Okay. Now that you've checked your combi tube and you know that it's ready to go, you want to lubricate the distal aspect of the tube. And then I'm going to instruct my partner to stop ventilating the patient and to remove the BLS airway device. I'm going to move in at the patient's head and place the patient in a neutral or sniffing position. And I'm going to utilize my thumb to do a J-hook. So I've placed my hands on either side of the patient's mandible, and I'm going to provide gentle upward pressure in a J-hook fashion as I introduce the combi tube and then rest the two black lines between the patient's teeth. Okay, then I'm going to inflate the proximal or the distal cuff, which is marked as number 1 and says 100 milliliters. Then I'll go ahead and remove that syringe, and then I will grab the proximal cuff, which is number 2, and says 15 milliliters, and I'll introduce 15 milliliters of air, and then remove that syringe as well. It's important to remove those syringes right away so that the cuffs don't leak through the syringe. I'll remove the mask from my bag valve mask device, and I'll connect to lumen number 1, which is blue and has a number 1 on the side. I'll then attempt to ventilate the patient through lumen number 1, and I'll have my partner assess lung sounds. If lung sounds are absent, I will then disconnect from lumen number 1 and connect to lumen number 2, which is the white or clear lumen, and then reattempt ventilation through lumen number 2. If lung sounds are present, my partner will listen over the epigastrum. And if there's no sounds over the epigastrum, that is confirmed that this combi tube is placed in the right place. We will go ahead and secure it with a commercial securement device, such as a Thompson tube tamer or some tube tie. Once that's done, we'll place a C-collar and reassess patient for changes. And this concludes placement of the dual lumen airway device.